Joe Radich. Welcome to the podcast.
I'm here, Austin.
Only here for 2 days, fly out tomorrow. I guess 3-ish, kind of.
Yep.
Right? You're over at Kuya setting up their functional medicine program. What would you call it over there?
Yeah, I would say functional regenerative medicine platform, essentially.
Yeah.
Which I'm sure we'll get into. But we're excited. We love Kuya.
And I'm excited to have you on because I think this is maybe the first conversation I've had on this podcast. I took like a 2-year break, so I can't remember what I recorded. But to actually sit down with somebody who it seems like you have a really good, experience, but understanding of how to integrate everything from hormones with blood work to even stem cells. I know at your place in West Palm, you guys do skin and face and beauty. And I've always wanted to have that conversation so my clients can educate themselves, because telemedicine in the last, what would you say, 5 years, it started to kind of pop off.
Really the post-COVID time frame, which is really kind of that 5-year-ish mark. Yeah.
And so I think it's becoming like right now, I think you had that functional health launch and more things coming out where it's becoming much more mainstream. And I think we're getting close to a tipping point where not as many people are skeptical. Maybe people that me like always question the medical community were already down to go try alternatives. And I grew up in Seattle, and it's like Bastyr University, like home of one of the best naturopathic schools. So there was naturopaths everywhere, which is actually very different from what you guys do, which is I kind of want to talk about too. But I want to talk about why you even got into what you do now, and tell us a little bit what it is you do and how you got here.
Yeah, it's a great question. So, and I get this question a lot, it's like, because you don't really see a lot of, nowadays we see more functional and integrated medicine, but I'm in the functional medicine scope for 15 years. And back then it was like, what is this?
Voodoo science.
Literally, is this just voodoo, or like, what is going on here? And it's really not that, as I'm sure we'll talk about. But, for me, I'm traditionally trained just like any other medical professional is. And my background is actually orthopedic surgery. And I always tell this story because it was kind of like a really eye-opening experience that kind of like cemented to me that like I need to get out of traditional medicine because it's like wrong. So I was working at a orthopedic surgery group in New York, which is where I'm from, New York City. And I was doing joint replacement. So I would spend 90% of my time in the operating room. And I was doing a consultation on a patient who came in with knee pain, who was a potential knee replacement candidate. And at this surgery center where I was working is a very prominent group in the New York tri-state area. And I don't want to use the name. But orthopedic surgeons are pretty notorious for very large egos, to say it nicely.
It's funny, back when I was in Seattle, we had the UW medical channel, and I guess there was a big orthopedic, it's a big medical school there. And I would watch the knee surgeries. Remember they used to broadcast those? Yeah. I could see why though, because it was so like you're literally taking a joint out and replacing it.
It's barbaric.
Yeah.
It's crazy.
And you see the after, they look like they've been sawed open. Mm-hmm. Yeah.
So I go in, I do this consultation on this on this patient who is complaining of knee pain and like, really getting to the point where they're contemplating knee surgery. So I go do this consultation, and then my colleague at the time, so I go in, do the consultation, I come out, and my colleague says, well, is this a knee candidate, right? Total knee means, are we going to replace the knee or not? And long story short, I didn't feel good about the patient. The patient was really sick, uncontrolled diabetic, 75 pounds overweight, a smoker, just like the epitome of like sickness, right? And so I really didn't feel like he was a good candidate to have a knee replacement. My colleague turns to me and he goes, well, are we going to replace the knee or not? And I said, well, I'm going on vacation. If you want to take this case, sure. I don't think he's a good candidate, but I don't think I would do it. But if you're going to take the case, then sure. Long story short, my partner took the case, and let's just say there was complication after complication after complication. And even before booking the surgery, my colleague, he goes, well, I don't care about this patient's type 2 diabetes. What do I give a S about this patient's type 2 diabetes? I don't care. Not my problem. And from there, I was like, oh gosh, I was like really rethinking, like, do I need to be here doing this?
Mm-hmm.
So fast forward, the patient had the surgery, complication after complication after complication, ended up with an infected septic joint, 6 months in the hospital, IV antibiotics. Long story short, about a year later, I found out the patient died.
Wow.
All because he didn't care about that patient's type 2 diabetes. And I was just like, when I found out that patient died, I was like, I can't continue to be in traditional medicine. I took a Hippocratic oath. We all take a Hippocratic oath as medical professionals to do no harm. And it just wasn't being honored following traditional healthcare. And I was like, I can't do this anymore.
So why do you think he has that mindset, other than like he's developed this ego, but why do you think in traditional medicine it is viewed in such a, like you're just specifically honing in on one problem and unwilling to consider? Is it the way when you go through medical school that you're taught in such a systematic way for a very particular like modality that you're trying to do, whether it's, urologist or, orthopedics, and you just don't consider anything else?
Truly, I think that's the root of the problem. I think we're trained in such a systemic, compartmentalized way that we lose the broad picture of the whole body, right? Our body is such a crazy complex organism of hundreds of millions of chemical reactions every second. And so for us to be so segmented, it's really a disservice. And that's where our current medical system is. It's so compartmentalized and subspecialized. And the other big problem there is none of these subspecialties communicate with each other.
Mm-hmm.
And the analogy I always use is we got to think of our bodies as this chain, right? And just like a chain has individual links that work together to make the chain strong, our body is literally no different. We have individual chains or organ systems that work together to make sure the whole chain is strong. And unless you really take that like high level, whole body approach to your health and well-being, you're not going to be well.
I totally agree. I've had a few clients in the past that they later in life, which happens to a lot of people, they hit like 30s and they develop problems in their health that they can't seem to figure out going to the regular doctor. They get sent around to different specialists, and then maybe they go to someone like you or naturopath or whatever, and they discover all these ways of potentially helping themselves that are completely out of the scope of what they're used to. And they'll get really mad. And I go, in a lot of ways, you can't get mad at regular Western doctors because they're only operating in the system they were taught.
Right.
And so there's no point in getting upset about it. That's why you need to educate yourself and have different people, like a team that you see that understands. And that's why, I value what you do, because you have a much broader perspective. And I think similar to me, you have things that are outside of what you can't do. So like the MRI scan or other recommendations that you're like, maybe look into these things. And I think a big piece when we had our conversation in telemedicine is educating people, right? Because I think you wrote a book called Autonomy.
Yeah, autonomy, yeah.
And I've always been about that. It's you have to figure it out for yourself, but with like the right teachers and doctors around you. And you don't need to accept what just one person says. Right. And the more you can expose yourself to different information and educate yourself, then you can help yourself. But at the end of the day, it's like, it's up to you. So like my dad's dad was an anesthesiologist. His mom was a nurse. My mom's mom was a nurse. And I can see it when as he was raising us, it was always like, if there was a problem, he would try to, like, we had a medicine cabinet full of stuff, right? You have a thing, you take ibuprofen. You do this, you do that. Mm-hmm. And then, if you have this problem, go see the doctor. Whatever he says, you do it. Me being a rebel just from day one, being I always questioned everything. I would even question my dad's doctors. And there was one time my dad's doctor, I used to go to, like, this is how old medical, maybe some people do this. Every 6 months, you get that call, go for your checkup. You go in there, they've taken your blood. They don't share any of it with you. They're like, it's good. You're like, okay. And then, physical exam, listen to you breathe. They're like, okay, off you go. And then maybe you have a thing, but the way they always kind of talk down to you, like looking at you like, you're an idiot. And well, I'll just listen to you. And like, maybe I'll consider it. And it's like a 5-minute visit and then it's over. I remember my dad had like a little nodule that had been there for a year or two. And I went to his same doctor and I go, Dad, this guy looks like he's dying. He's not taking care of himself. He's not healthy at all. I would not listen to this guy.
Right.
2 years later, he goes to like, I was for cardiac something. And he's like, we should go get this scanned. And he had basically non-Hodgkin's lymphoma. For like 2 years, because it wasn't even actually taking him seriously. So frustrating.
It sucks when I hear stories like that. I hear stories like that all the time, because to your point, it's just healthcare, the way it's delivered now is just not true healthcare. It's crisis intervention, right?
Totally. Once you're going there, it's rough.
Correct. And it's just a never successful journey. Now we're making generalizations, right? There are caveats to this, but like you said, you go to your primary and you're in the exam room for 12 minutes, and of the 12 minutes, you're waiting for 7 of them. 5 minutes, what can you accomplish in 5 minutes? Nothing. You can't even have an intelligent, mutually beneficial conversation in 5 minutes, let alone have a conversation, talk about symptoms, talk about blood work, talk about short-term, talk about long-term. It just can't happen. So it's a system that's literally set up to fail.
Yeah, like the doctor will rush in, just had another patient, sits down, looks at his computer. He's kind of listening to you while he's just analyzing the chart. So it's like, it's so rushed. Mm-hmm. It's so not present. I have one more story, and then I wanted to continue how you even transitioned into this and discovered it. But so when I started to realize my mom was like complaining my dad was starting to have weird memory issues, and we were like, okay, I think he's starting to develop Alzheimer's potentially. It took us a year to get him in there because he lived in another state, and we try to get him to make an appointment because he was the only one who could get in a portal. He'd make it, but then he would see it and cancel it because he was like, what is this appointment? So it took forever. And we're like, me and my sister, like, if we can just get him to see the neurologist. He goes to see the neurologist. They do a scan. He sits down with him and he goes, yeah, you definitely have some plaque buildup. It's early Alzheimer's, and maybe you could take some B vitamins, and then here's this medication. Doesn't ask him about sleep, doesn't ask him about exercise, doesn't ask him, this is like during the pandemic, how that's affecting him, doesn't like his wife's got cancer, how he's emotionally doing, literally nothing. And then that was like, I'm fucking done with all these people. I'm so done with all these people. Like, that's why you have to, like with that, it's like there's so much he could have done if I was there and had ability to bring him to a place like you guys have. Mm-hmm. Like, there's so much you could do. Like, what's his insulin? Is that affecting? Yep. Right? Does he have inflammation in his brain? Yep. Right? Like, what are all his blood levels? Like, bags of stem cells for IVs for more inflammation, getting his cardiovascular health, right? Just, there's so many things you could do. Mm-hmm. It's like, oh, and then you think, does he go home and just disassociate? Like, as a person who's treating people with Alzheimer's, isn't your goal to save people? Wouldn't you consider all modalities of trying to do that? And sometimes you will run across doctors that live a healthy lifestyle and they really embody it in the Western medicine, but it's so rare. And if you can find one of those, amazing. But it's like, it's so shocking to me. So you are fed up. You leave New York?
Left New York, left to Florida, greener pastures.
Yeah, definitely.
Yes. Ended up heading to Florida, where, again, kind of the lifestyle is different, right? And that's actually one of the things that's really important for what we do in functional medicine, is helping to understand someone's lifestyle. But ended up getting to Florida for a happier, healthier lifestyle for me personally. And then I knew from the beginning that I had to get out of the traditional medicine model. And my passion always was kind of more alternative medicine, sports performance. I played a couple sports in college. So I was always kind of more attracted to, health optimization, right? And so I ended up doing a residency program through the A4M, which is the American Academy of Anti-Aging Medicine. They're basically like the global kind of leader and oversight for what we do in the integrative medicine space. I did their residency program, and as soon as I completed that residency program, I was like, light bulb. It's like, how did I work in traditional healthcare for the 3 years leading up to this? And I swore to myself that I would never leave. And that was 15 years ago.
Wow.
Yeah.
And so did you just immediately start with a small practice and just kind of build from there?
So when I moved to Florida, I joined an existing longevity office that was up and running, and I basically was their lead clinical practitioner, and I pretty much saw every patient. So I actually was working for a clinic in South Florida, but I was still getting kind of met with resistance and limited as far as what I wanted to do or what I could bring into that practice. So part of me was just like, well, screw it. I'm just going to kind of do it on my own. So I was working at that clinic full time, and I actually just started seeing my own patients at nights and weekends. I was actually literally renting a room in an existing primary care's office.
Wow.
I was renting a room for like $900 a month, and I was seeing patients at nights and on weekends, to kind of start my own private practice. So
that's how you know someone has a passion. It's like me, I trained all day and now I'm here podcasting because I love it and I want to help people, right? It's like there's no reason you needed to do that. You were probably making fine money and you probably needed time off to go exercise and take care of yourself. But you're like, no, I'm driven.
That's right. And that's really what it was, because it was, as I'm sure you know, like it's a lot as you're trying to build and grow, and it's a lot. And I was working full time on top of it.
Wow.
So it was a lot. But again, I'm so grateful that I did it and committed to it, because I rented that room for probably about 6 months, and we just grew organically so fast that I was able to support myself just seeing those patients. So I quit the other longevity
what year
clinic.
Is this real quick?
2011, 2010,
Wow.
2011. Yeah. And from there, when I was able to support myself enough just by seeing those patients, I fully committed. I stayed renting that room for about 9 months. And then I was able to, kind of get into a larger space, started hiring more people, and we are completely organically grown. We still to this day do 0 paid advertisement.
Wow. That says a lot.
Yeah.
So I want to go through kind of how you've set up your clinic, why you brought in things you brought in, how you bring someone on board and kind of guide them through becoming in control of their health and kind of help them figure out what they should do, shouldn't do, and also just the modalities they should be aware of.
Yeah. So for us in functional medicine, my role is to help educate you. I'm never going to make a decision for you. I'm never going to dictate you to do this or to do that. And that's where traditional medicine, right? Your doctor gives you a prescription, you take it, you don't ask any questions, right? It's crazy that is the one area that we get brainwashed. Mm-hmm. You don't question your doctor, right? It just doesn't happen. No. And it's crazy, right? Because it's your body. It's your health. If you don't feel right about something, you should probably stop, pause, time out, question, right? So for me, my job is to just educate you. So we really focus on making data-driven decisions, right? We want to take a really in-depth look under your hood, get to know you, get to know your lifestyle, get to know your biology and your physiology. And we mesh all of that together to really make informed data-driven decisions. So we do a really diagnostic set of blood work or saliva testing or whatever the analytic is that we're focusing on. And then we analyze it in context of your lifestyle, right? Do you exercise? Do you eat well? Do you travel a lot? Are you stressed? How do you sleep? How's your gut health? All super relevant data, just as much as blood work is. We mesh all of that together, and that's how we're able to kind of come up with what a wellness program might look like for you, because it has to be individualized. And that's another key differentiator between traditional medicine and what we do in the integrative space is traditional medicine is cookie cutter.
Mm-hmm.
It's literally flow chart medicine. There's hospitals that have literal flow charts, right? If you show up in the emergency room complaining of chest pain, it triggers 6 things to happen.
Mm-hmm.
It doesn't matter your age. It doesn't matter your gender. It doesn't matter this. It doesn't matter that. And that's maybe not the best example because it's an emergency situation,
Mm-hmm.
but it's flowchart medicine.
I mean, a perfect example is like if you go in and you have a gastroenterologist and you have acid reflux, you either have surgery or you have an array of drugs over the counter, or we can get you a prescription.
Yep.
But that's the 2 options based on, he's got 3 of the 4 symptoms. So then we go to drug or this. Right? There's no, and then maybe here's like a printout of a basic food thing that's never been updated or, even considering like if you're allergic to something or anything. I was like, oh, here you go.
They don't once ask you about your diet. They don't once ask you about how much caffeine you intake. They don't ask you any of that.
Or stress.
Right. And they wonder why you have heartburn. It's crazy, but it's truly flowchart medicine. So traditional medicine, again, you get blood work done, your primary care, maybe they look at cholesterol, right? Your total cholesterol is at 220, which technically is high. You're leaving with a prescription for a statin. Doesn't matter how old you are, doesn't matter your lifestyle, doesn't matter anything. It's just flowchart medicine. And so for us in the functional medicine space, we want to look at all of the relevant data points, talk to you about your short-term goals, your long-term goals, and that's what helps us put together an all-encompassing wellness plan, right? So people always ask me, well, what do you do in functional medicine? What does that even mean? We are the perfect blend of Eastern and Western, right? Because like we were talking about earlier, it's not shamanistic herbs and all this kind of voodoo stuff. Not that herbs are bad, but there's this misconception of what we do in functional medicine where it's just like fake or snake oils, right? But it's not. We're rooted in healthcare and medicine. Everything that we do is rooted in medicine. But we want to find a more natural approach to helping accomplish the same goals. So that's kind of the key difference there.
I think also the difference is with you guys, there's a lot of functional medicine places popping up. Take your blood work, analyze it, do, optimization of hormones and maybe the peptides and vitamins, but they're not necessarily considering much more outside of your blood work. So it's like kind of better. Like you could use it as but you would have to have another person or 2 more people that are considering the other things you're doing in your life. They're just like, it's like they ran a diagnostics and maybe they're doing a better job, dialing in your blood work and now you understand it a little better, but they're not considering goals and then all the lifestyle factors and where you're trying to go and trying to help you understand how to change that.
Yeah, it is. It's a critical piece that gets overlooked in a lot of instances. People, live off analytics, which is great. We're in a data-driven society, which is fine, but it is important to understand someone's lifestyle or, for work, they have to travel on a plane, every week, right? Like those are factors that affect or influence your physiology. So if you fail to understand the importance of living in that lifestyle, you're still not going to have great success. So it is super important to kind of get to know someone and understand their life or what their life has to be or the stressors they're going through or what their diet habits are like, because that's going to also impact our decision making and how we promote or, kind of put together a plan for you.
And you also give people the ability to consider things, right? Like if, say, a female comes in and she's 40 and maybe hormones are here and there, you may present options and they don't necessarily have to maybe take supplements or hormones. They can kind of like, you can give them the pros and cons and guide them of like, where do you want to go? And some people are like, send it. Give me all the stuff you got and let's go. And some people are like, I'm going to see if I can optimize this on my own for 6 months. Right. And I think that's important for people to follow their own intuition, even if it's not necessarily the right decision, you're going to learn so much more learning to trust yourself. And you can always come back and go, okay, I at least tried. I understand it is maybe out of my hands. I do need to, start, supplementing hormones or like thyroid or whatever it might be.
Yep.
And so I think that's important.
I couldn't agree more. So we talk about this all the time. The brain is a really powerful thing. And for you as a patient, you have to feel comfortable with the plan that you're implementing on yourself. And agreed, if we throw too much at some people and people feel overwhelmed or they don't feel confident in that plan, again, that brain's powerful. So we always present a conservative plan, a moderate plan, a more aggressive plan, and we leave it to the patient to decide what they feel is the right next step for them.
Yes.
And that's huge, right? Because it can't be this like healthcare dictatorship. That is not going to go well.
You need to be on this if you want to be successful.
Right.
I tried to do that. I think that's why maybe I resonate with you so deeply, because it's the same with me. It's, I'm a trainer, so I see people a lot, more probably than anybody in the health space. I see someone 3-4 times a week for a year.
Mm-hmm.
That's a lot of conversations and getting to know somebody. And as somebody working out is a good reflection of what else is happening in your entire life.
Yeah.
Sleep, food, like it sends a good feedback. And then depending on where people want to go, to just because I just try to optimize for people to perform as well as they can. And if I do that, they're going to get results. And so as they continue to train, if things aren't changing in the way they want, I just present potential solutions, but it's up to them. And some people aren't ready for some people they don't want to give up alcohol, and it takes them a year and all of a sudden it clicks. But it's never forcing anybody to do something, because if you did force somebody to take all that stuff, then they're going to go, functional medicine doctor's no different than my other doctor. He's forced me a bunch of bullshit, and then it's like, fuck all of it.
Yep, 100%.
And you're like, screw it all.
Yep.
I think with blood work, before we go into the other things you guys offer, getting into common things you see in blood work with women as they enter their mid-30s to their 40s, and then even 50s, and maybe we can hit if there's different avatars that more represent 35 definitely than perimenopause and menopause, the things you see. And I think what I also liked about you when we did my hormones is there's a lot of you can see ranges and you can optimize those ranges, but I think because you have a lot of experience, you probably have a lot of feedback too. As me training somebody, you get a lot of feedback, so you learn more of the art and how things can go and change. And so, yeah, maybe there's a common standard of like for men with me, optimizing testosterone, but then not taking an HCG or something like that. And it's in these functional medicine clinics, it's oh, it's fine if you're not worried about kids. Right? Okay. Where you were telling me, well, you can, share a little bit, which I was I've never heard somebody say that. And I watch a lot of videos of doctors and people out there, subjects on longevity and that. Never heard that mentioned before. So I think that's extremely valuable, having somebody who's seen a lot and it's not just one way.
Agreed. And I think to your point, there's one approach to look at blood work and make a decision based off of a number on a sheet of paper. But then there's another approach where you're blending that data point with a lot of the subjective feedback that we get from the patient or the individual, right? Because a lot of what we have to do in functional medicine is read between the lines. Mm-hmm. Not everything fits into that flow chart medicine. And your body is different than mine. My body is different than someone else's. And so even though the number might look normal or okay on paper, it doesn't mean that it's right for your body, or it doesn't mean that it's optimal for your body. And so we have to take all that into consideration when we're looking at blood work and interpreting panels, et cetera, because a lot of times just because something is, quote, normal, one, it doesn't mean that it's normal for you and what your body needs, and it doesn't mean that it's truly optimal for what your body needs. So that's huge, and that's one of the big differentiators, 100%, yes.
Do you have maybe an example of someone in their mid-30s that you could, obviously not their name, but where you see things where you need to optimize their hormones? Like, I think it's a story or a specific client that you can kind of share.
Well, so I think kind of going back to what you were saying, I mean, we work with a lot of women, and a lot of times women think that a hormone problem is an older woman problem, right? Because everyone equates hormones to perimenopause,
Mm-hmm.
right? Our patient demographic is so skewing younger nowadays because we're identifying not necessarily old age hormone problems, but hormonal imbalances. I can't tell you how many women I see now in their teenage years and early 20s and mid 20s and 30s with a hormone imbalance, right? And again, what does traditional medicine do? Traditional medicine doesn't really know how to manage hormone issues in women. It's crazy to think about.
Mm-hmm.
Your GYN, your endocrinologist, they don't know how to manage hormones. Their solution to a hormone problem, throw somebody on birth control. I get these 11, 12, 13-year-old girls on birth control.
Wow.
And it's the absolute worst thing ever. So birth control, and this is a story, but this is general because I see this all the time. I have women, younger girls, 11, 12, 13 on birth control. I have women at 20, 30, 30s, 40s on birth control to, quote, regulate my hormones. Birth control is not regulating anything. All birth control is doing is putting you into menopause, a pseudo-menopause state, so that your levels are not fluctuating. They're flat. So how does traditional medicine deal with a hormone problem? They put you into menopause.
Wow.
So they don't have to worry about navigating the ups and the downs. Birth control is bad. If you don't have to be on it for contraceptive purposes, there is not one benefit to being on birth control.
Yeah, I've had a lot of clients in the last 5 years, share their stories of coming off, and some of them it's a 2-year process. Yeah. It really messes them up.
Yep.
And a lot of them are really angry that they got put on. Same thing. They were just told to do it. They trusted it, and then they're just on this hormone.
Well, a lot of times, and for women, again, women struggle, difficult periods, heavy periods, becoming low iron or anemic because their periods are so crazy. And so I understand the reason to just kind of jump in because you're like sick of feeling sick, right? With tough periods. But that's not a solution. As a 18-year-old girl, 25-year-old girl, it's not healthy for your body to have hormone levels of a 55-year-old female.
No.
Think about what that's doing to your body. So these women that get put on birth control at 14, 16, 18, 20, and they're on it for 20, 30 years, you're a trainer. What happens if you don't do bicep exercises? Your bicep weakens, it atrophies. Imagine as a female, if your body is suppressed to make hormones and your uterus doesn't make hormones for 30 years, what do we think is going to happen? It's not going to be good.
Do you think that's part of the reason a lot of women are having difficulty getting pregnant?
The rise in infertility in the last 10 to 20 years is mind-blowing. And yes, I do think that is a big part of the reason.
I mean, it makes sense. Like if you were a guy and you were placed on some hormone and it suppressed your natural production for 20 years, it's going to be a rough restart.
That's right.
Really rough.
That's exactly right.
And so what do you do in that case? And like, what are potential ways to help kind of get the system back on? Or I imagine for some people, the system can't come back on, so they need to, introduce hormones themselves long-term. Mm-hmm. How does that look?
Yeah. So, I mean, for both men and women, our objective generally is to try to stimulate more of that natural hormonal production. That's always our number one goal. And some people, we can do that really easily and really successfully. And some people, we have a harder time or it's not achievable. So, our goal is to try to get the hormones being produced again on their own, which there's great ways to do that and very safe ways to do that. Sometimes we do have to talk about more aggressive formats of therapy, whether it's hormones or peptides or other kind of stimulating compounds. But that's our goal, especially for women, right? So for women who get put on birth control to, quote, regulate their periods, It does. It takes some work and some effort. Again, for women, they're cycling different hormones throughout different times of the month. And so the key is with hormonal regulation for women is finding that balance and that homeostasis. A lot of times women struggle with difficult periods because of an imbalance. Either they're estrogen dominant and they're producing too much estrogen, or they're not producing enough progesterone, or their cortisol levels are really high and they're in adrenal distress, and that creates DHEA problems. And it's an imbalance of some capacity. So what we have to do is we have to try to identify where is that female hormone imbalance and how do we restore that balance. And that's what regulates the periods, like truly regulates the periods. And that's how we can get women off birth control, but also not subject them to going back to these crazy periods. And that's what we work on.
I love that. Yeah, I've been recommending more and more of my clients to come see you, just because starting to lift weights and exercise is going to really help your hormones in general.
Yep.
But it's always good, the sooner you can, to know where you're at. Even if you don't do anything, to see how you changed in your blood work over the next 6 months of just making fitness and wellness lifestyle changes.
Yeah.
And then if it doesn't, then you already have this data, right? To know what's going on or it's not working. Also, to get more out of your efforts now that you're putting effort in and taking control of exercising and eating well and sleeping well, you want to get the most out of it. And the sooner you can do that, the better. I think the old way of thinking was like putting on like guys like, oh, wait till they're 60, 70, get them on hormone placement. And I remember one day I was thinking about it. It was like, why would you wait until you've lost so much strength and physical ability and fitness to then try to maintain some strength? Because now you're just going to maybe gain a little bit back or maintain that and slow it down. Why wouldn't you want to do that when you're actually young and healthy and have the ability to train and get more fit and then maintain that? Yep. And I think that's the optimization piece, right? It's like maybe you're feeling great, but could you increase your performance and well-being now? Because it's like a retirement plan. The healthier and more fit you are now, the more you have to pull from later, right? Yep. And if you just kind of wait till later, it's like, well, you kind of pulled the brake a little too late. I'm sorry.
True.
Right?
It's so true. We're starting to really try to help people understand the importance of early detection, and not even detection, because we're not necessarily looking or finding problems, but to your point, like establish your baseline. Establishing a baseline at a young, healthy age is going to help us quantify change over the next 5, 10, 25, 50 years. So the earlier that you can get yourself established, a good baseline while you're young, fit, and healthy, it gives us a great benchmark to be tracking against. And so we can really start to identify those early signs of change because we've got that good benchmark from the beginning. So I agree completely. And we're starting to see that shift. For us, our functional medicine patient demographic, it used to be 40 to 60 years old. But nowadays, it's 30s, 20s, which really, I'm happy about that because people are starting to really understand like, hey, if I can get ahead of this now and really optimize now, it'll actually prevent the amount of work I got to do in the long term because I'm keeping myself on that good trajectory starting now. If you put yourself on a bad trajectory at 20 versus 50, that 30-year gap is a huge delta on the same trajectory. So being able to establish that baseline is huge.
I mean, it's the same with people that's why the sooner you can start lifting weights, the better. Because someone comes to me and they're 70 and they've never really lifted weights.
Yeah.
And now they're pretty frail, right? They've lost a lot of muscle mass and maybe they can do a couple body weight squats and then they get fatigued. It's going to take so much time and effort to get that person to even just like pretty good or kind of strong because you're older. It takes a long time to recover. You have to stay really disciplined. You're older, so it's like you're learning things that really out of your comfort zone. So that's a little more challenging for older people. It's just, it's just a lot different. If you've worked out for 20 years and then you get to your 70s, you could take a year or two off and you could probably get back pretty quick because you've built that in. I'm excited to see, because I see more, like if you see 20-year-olds doing that now, I see parents like getting their kids to lift weights and doing that. It's like, imagine in like when 20-year-olds are in their 40s, 20 years from now. I can't even imagine. It's going to be really interesting.
It is. It's really great. And it's great that that piece is starting to kind of shift. And really what I appreciate about kind of what you do in the physical space is people, again, kind of underestimate the importance of being mobile, being flexible, being strong. They do a lot of research about these blue zones, right? So the areas of the planet where people live well into their hundreds and these centenarians. And one of the ultimately common denominators of these blue zones is movement. And it doesn't need to be, in, these rural parts of the hills of Italy, they're not, at the gym, crunching gym rat weights, right? But it's movement. Mm-hmm. It's that movement component that is the common denominator in a lot of these blue zones and these centurions.
I mean, the women are cooking for a couple hours. I mean, to lift all those pots and chop and do this, and then maybe go in the garden and then walk to your friend's house 2 miles away. That's a full day of exercise. Yep. So yeah, it's such a vital piece. Outside of blood work, what are some other tests in addition to just like your regular blood work with like your hormones and vitamin levels that you can recommend? You have stool tests. Do you have genetic testing you like to do?
Yeah. I think a couple other really key areas are, really looking at gut health. I think gut health is huge. I think genetic health is very usable and really important data because it helps us get to understand your pre-susceptibilities or, kind of your genetic blueprint, right? So we understand things that you might be higher risk for. We're getting a lot into, kind of full body MRI diagnostics, again, looking at anatomical variances, looking for early signs of degeneration. So we love doing those types of diagnostics. For us in the longevity side of what we do, we love doing, testing that looks at something called your telomere length, which is truly the strongest predictor of our aging process.
How do you do that?
So a telomere test really is just a blood test, but it's a very specialized test. So high-level overview, your telomeres are the end caps of your DNA, your chromosomes. We know that as our cells multiply, the end caps, these telomere caps, they actually start to shorten. And once that telomere cap gets to a certain critical shortness, that genetic material basically gets dysfunctional. And when that genetic material gets dysfunctional, the cell doesn't work effectively, the cell dies, enough cells die, inflammation, disease, death. So we now know that the key to longevity is maintaining this telomere length. Or what can we do to lengthen that telomere cap? The simplest analogy is think of a shoelace, the shoelace that has the protective plastic tip on the end of it. Mm-hmm. Think of your telomere cap as that protective plastic. And as that shoelace gets older, that cap gets messed up, it breaks off, the shoelace then gets friable and frays, starts to rip. It's the same exact analogy. So we now understand that there are ways to quantify your telomere length, and there are strategies that we can actually help to slow down the shortening of your telomere and also reverse it and make it longer.
Does it test, is it just general telomere length, like of all the DNA in the body? So it's just like telling you this is the total sum of all your ability to continue to reproduce without problems.
Correct.
Very interesting.
Your DNA ages at the same rate, no matter where it comes, what part of your DNA.
Oh, I didn't know that.
Mm-hmm. And so that's where we can look at a telomere length, and it's a general representation of your entire body's aging process.
Okay, so if I was wearing out my telomeres because I was, let's say, not sleeping or doing something like drinking a lot, so I'm stressing my liver, so it's having to recover a lot, that doesn't necessarily mean that could have like a mutation like cancer or whatnot. It means all of your body is at risk. That's interesting.
Correct. It goes back to that chain analogy. If that liver is stressed and that's the one weak point in your chain, it's still affecting your whole chain.
That's really interesting.
Mm-hmm.
So how do you lengthen a telomere?
That's a whole podcast by itself.
Really? Okay. Well, what's like a general...
All the things that we know and that we preach about in functional medicine.
So that like just becoming healthier can potentially extend it?
Yes.
Okay.
Not only can it slow down the shortening process, but it also can be reversibly lengthening the telomere cap. So all things that we talk about, hormone optimizing, inflammation management, keeping your immune system strong, those are all key foundational principles to maintaining telomere length or reversing telomere length.
That totally makes sense. And then I want to touch on the genetic testing. When you do genetic testing, what are all the, like, how much is it? So one time I did a genetic test and they sent me a piece of paper back and they're just like, you have these two things. But then they didn't tell me anything else. And I always hear on different podcasts and whatnot, like, oh, I process caffeine slower, or I'm susceptible to this. It's like, well, you guys didn't give me any. So what did I just get? Like, I didn't learn really anything other than you might die from these two things potentially, but I didn't learn anything else of like how my body operates and runs and maybe even just affect that.
And so that's the important part about genetic testing. People who are going to commit to doing some genetic testing, it's about, well, what is the data going to tell us? And then how is that going to change our life, right? And it sounds like you didn't get the latter piece of that, which is not great.
No. Left me very confused.
So genetic testing basically helps us understand your blueprint, right? So your body's genetic blueprint, the way that your body was built or coded. And by doing genetic testing, we can learn your body's vulnerabilities, right? Hey, you have this code in your genetic is like a weak point. So, hey, this disease process may develop because this is your body's weak point, right? Doesn't mean you're going to have the disease or get the disease, but hey, you're more likely to get it because of the way your body is coded. That's what genetic testing is really telling us. Now, why it's relevant is because you take that, you now know, hey, you're more susceptible to type 2 diabetes, as an example. Now you can really start to be laser focused on the things that we know contribute to diabetes, your nutrition habits, your exercise habits. We now know we need to look at your insulin levels for early indication of insulin resistance. Or we know that, hey, we need to look at your lipoprotein profile because that's an early indicator of type 2 diabetes. We now know because of your genetic code that you're more susceptible to developing diabetes, so we can start to look at some of those earlier outside the box factors that can give us an indication much earlier that you might be developing or on that diabetic pathway.
Which just gives you more motivation and tools of what you should focus on, especially when it comes to like exercise or daily habits or just even your environment, which you're not going to be able to really change. It's like now you have an understanding of you definitely need more cardio. Like you should definitely focus on cardiovascular health because you have these risks. And you're fine. Your grandma lived to 100 and she's good and she only walked something like that. Yeah, super helpful. Okay, so I already have to order multiple tests that I haven't done yet. I'm super pumped. Yeah. And then I wanted to talk to you about the MRI scans. Like, what do you like about those? What do you think they aren't great at? And who do you recommend them for?
Yeah. So the whole kind of whole body MRI scan era, we're in it for sure. I am nothing but supportive of it. So I think there's a lot of misconception about what it is, right? So people think of it as like a cancer screening test or scan. And it is that, but it's way beyond that. So the beautiful thing about, kind of the full body MRI diagnostic is, again, it goes back to helping us establish your baseline. So I'll share my story with it because I think it's useful. So I did my full body MRI screen. And I'm healthy, I'm young, I'm under 40, I take tried to take good care of myself. Like I don't really have any major medical issues, but I wanted to establish my baseline. Like, hey, let's see the scan. Let's see if anything comes back and we'll go from there. So one of the things that came back on my scan was that I have an anatomical variant that I had no idea about, right? So it turns out that as humans, we have two tubes or kind of pathways that come out of our gallbladder, right? I was only born with one of them instead of two of them, right? Now, I have no way of knowing that. I have no stomach issues. My blood work looks fine. I eat what, like I'm fine. But now knowing that anatomical variant, I am at a higher risk for gallbladder stones. I am at a higher risk for detox issues. I am at a higher risk for all of these other things because of my anatomical variant. So if I hadn't done that scan, one day my gallbladder gets clogged from a stone and I'm like, well, why? I'm super healthy. Like I eat pretty well. Like why? Oh, I have this anatomical variant, which makes it likely that I might have a kidney stone now. So it's stuff like that I really put these types of diagnostics on people's radars because it helps us, again, get to know your body in much more detail. It also looks for, obviously, big picture things, cancerous masses, degenerative changes, all of which is very useful because some things we don't feel until it's too late, right? Certain cancers or certain musculoskeletal changes, right? We could scan 9 out of 10 people and they're going to have abnormalities in their spine. It doesn't mean they feel it. So it's nice to kind of just start looking at that type of stuff and try to intervene before that disease process or that degenerative process gets to that stage where it's too late.
Yeah, I think they're building one here in Austin.
They are.
And hopefully it's soon because I definitely want to go check it out and try. I try to try everything that I recommend instead of just send people to it because I think it's important. Does the scans give you insight to the vascular system at all?
Absolutely.
Really?
It looks at every organ system, head to toe, every joint space, every soft tissue space, every major organ system. It looks at vasculature, so it can give us an idea of circulatory status, brain. I have this one patient who's younger, probably early 40s, multiple concussions and head traumas. And we did his Pronovo, and his brain scan was so atrophied and deteriorated, it literally looked like somebody in their 90s.
Wow.
Just from the head traumas that he's been through. And now we've got a whole plan in place to really work on neuroregeneration. But again, if we didn't do that scan, this guy's 40. I would never think he would have atrophy to that extent. So now we're starting that treatment process earlier, which is going to help him have better outcomes.
And neurodegenerative problems, once you have actual symptoms, that means it's been going on for a while. Like Alzheimer's or dementia, usually there's been an issue for 10, 15, maybe 20 years. And you didn't know about it. And once those things show up, you have like a small window to potentially slow or maybe reverse it, but it's done its damage.
Yep.
And then on the vascular real quick, is it similar, like, what is it called? A CT angiogram where like they put liquid and they can see? Is it as accurate or is it, that's like super specific and like, could you just replace that? And it's like, oh, I just got this, so I have a good idea of my vascular system. Because I have older patients and I've been hearing stories of like 40-year-olds, even 50-year-olds that like, okay, perfect example. I have a client who his father went, super fit guy, retired, works out 3 hours a day, having the time of his life, 70. Went to his regular doctor, blood work, fine. Goes, gets a stress test, passed it, no problem. But his functional medicine doctor was like, I don't know, let's check it. So they do that where they actually look deeper into like, I think CT only sees the hard calcium and then the other one sees soft. And he had like a 70% block, like a widowmaker. And this guy would have just kept full blast working out and he could have just popped.
Yeah.
right? So I think, and cardiovascular disease and heart attacks is the number one killer, right?
Yeah, still is.
And so it's extremely important to be aware of how your vascular system's doing.
Agreed. Completely agree. And, to answer your question, these full body MRI scans, they're great kind of screening diagnostics. And so I wouldn't say that it completely replaces a CT angiogram, but there are other scans that we do use. So perfect example, something that's really heart specific is a scan called a Cleary scan.
Okay.
And it's where we use a lot of this kind of full body MRI technology with a couple of other, really advanced technology modules. And it can actually mimic and even be arguably better than a CT angiogram. So the technology and the scanning process is continuing to evolve. The MRI, the full body MRI, is not going to replace that, but it can absolutely give you an indication if you should go for that advanced cardiac test.
Yeah. So yeah, that's great. So you can kind of get a full gamut of your anatomy,
Yes.
any potential to go deeper if you need to,
Correct.
instead of just ordering like I order this test and it's expensive, and then I get this test. You're only getting like pieces of body parts, and you're kind of guessing if you should get those tests.
Correct.
That's great.
Yeah.
That's really great.
Yeah.
And do you have any advanced testing for women when it comes to things like breast cancer or like ovarian, other than the classic, just like there's mammograms and like, I have a friend, she's super high risk. So the normal medical systems, like they want her to test all the time.
Yeah.
And so she's going to get all this radiation all the time. She's supposed to rotate back and forth between, I think it's MRI and then mammogram and MRI. And it's like debatable, like, is that pushing things along faster?
Mm-hmm.
Yeah. So I'm curious if there's a potentially better way for women.
Yeah, it's a great question. I mean, breast health is one of the biggest debates, and how do we monitor and how do we assess? Because to your point, every mammogram is just so much radiation, which is not ideal. So, yes,
if you're high risk,
correct.
like that's not what I should do.
It's like an oxymoron.
Yeah, like you're high risk for lung cancer. I need you to smoke this pack of cigarettes so I can see if you have lung cancer. All right, come back in 6 months.
It's crazy. Yes, there are some other things. I mean, a lot of times for women, we love doing ultrasounds. Ultrasounds is a great non-invasive tool for breast imaging. But really my go-to, honestly, for breast imaging or other gynecological imaging screens is a scan called a thermography scan. So a thermography scan basically looks for thermal imaging and heat patterns. So it turns out that cancer first presents itself as heat and inflammatory heat patterns. So we can do an infrared scan on you, and we can see what part of your bodies are higher inflammatory and light up. And that, in a lot of instances, can detect early gynecological cancers.
That's very exciting.
Mm-hmm.
Yeah. I lost a grandmother to breast cancer. My mom had breast cancer. And I think also my other grandma died from breast cancer.
Mm-hmm.
So, and during that time, one of the doctors gave one of my grandmothers a bunch of estrogen. So he just fed it like crazy. But I imagine it was the way they tested for stuff was so barbaric.
Mm-hmm.
It's unfortunate. Hopefully we get to the place where we can just avoid a lot of these things, because it causes a lot of grief and trauma with everybody.
It does.
Your health decline affects all of your family and friends, and it ripples out, and it can stay with you.
Yeah.
And it ripples out. So taking care of yourself is the most important thing you can do for your loved ones and your kids and the people that are around you.
Yeah.
It's not just for you.
Yep. It's so important. And it's important that you bring that up, because it is, and it's so much of living life is about relationship and connections and whatever your beliefs are regarding afterlife, etc. It's about being present. And to your point, it's one thing for people to be stubborn, and I always get husband and wives, oh, my husband is so stubborn, he won't come to the doctor, he won't get this checked. And it's important for people to really realize that it is not just you, it's everyone around you that gets impacted. And taking the steps and the measures to really better yourself is important, not only for you, but for your loved ones too. We see it so much in healthcare. Unfortunately, I do see and hear stories of tragedy, and we all go through it. We're all humans. I lost my dad last year,
Okay.
and it's hard, and it really does affect you, and especially when it's a preventable thing, or if you did just like do the scan or do the blood work, we could have totally saved your life, or, really impacted how your family lives. And it's hard sometimes, but yeah, you got to really just think about it from that sense too.
Yes. Now, I want to get into stem cells because it's a personal subject that I'm very excited about. I recently went to, shout out to Jamie, who gives the best Korean facials here. Does the lasers or electrocutes your face? Sorry, I'm not one of the ladies. I don't know what happens. Zaps your face open and then take some exosomes and strap some stem cells and shoot it into your face. And so more and more, like, it was a couple of years ago, it's like stem cells, at least in this area and around the US, is considered like, oh, it's dangerous, it's taboo. But the more you look into it, it just comes down to regulation. I think you were telling me some interesting things about Florida regulation, which I want you to share. But other than like joint and tissue issues, I think I'm interested in the applications through IVs.
Yeah.
Exosomes and stem cells. So tell me a little bit about how those applications are applied to people, for, I imagine, treating things like inflammation and whatnot, but then also just like just feeling better or even performing better, and how you're using those in your clinic. And I think eventually Kuya is going to start offering those here in Austin.
Yeah, absolutely. They are. So stem cells and exosomes and all these regenerative treatment modalities are phenomenal. And I think I want to start by just saying, like, these are things that have been going on in this country for many years. Stem cell and exosome therapy is not new. Now there's different ways and different types of stem cells and regenerative therapies. So super simple. There's autologous stem cell therapy, which is the process where we actually harvest your stem cells and utilize your stem cells. And then there's the second type, which is allogeneic stem cells, which are the stem cells that come from donors, and in particular, birth tissues. And this is where you might hear about umbilical cord stem cells or amniotic stem cells, whatever. So we do all of it. All of it has its up and its down and its pro and its con. So these are therapies that have been in clinical practice for probably 40, 50 years.
Wow.
These are not new therapies. And I think that's probably the most shocking thing for people to hear when we talk about stem cell therapy.
I mean, my client who gives the facial, she's like, Koreans have been doing it for 15 plus years. And I was like, really? It's like,
yeah.
And that's so funny. It's like US pats itself on the back for being so advanced, but then you got to travel to Korea or Florida, right? And do these things. And then the media makes it takes so long for it to be generally accepted because there's always so much negative talk about it, which just comes down to, well, drug companies can't make money on it just yet, so we're just going to talk shit.
Mm-hmm.
And then people get scared.
Right. They cloud it. And anytime there's hesitancy, people are going to generally not go for something. Right. So what is a stem cell? So a stem cell is our body's regenerative capacity, right? It's how our body regenerates a damaged or destroyed tissue. We all have stem cells in us, but as we age and as we put more stress on our bodies and our body has to repair things, those stem cells get tired. And when those stem cells get tired to a certain point, they stop working. And when they stop working, they don't necessarily die, but they're programmed to turn their switch off. So what we can do with autologous stem cells, we can actually take your stem cells that are turned off or dormant, and we can make them more excitable again. And then we can give them back to you in a more excitable state. That's autologous stem cells. And when we do that, again, it starts that tissue remodeling and that tissue regenerative process that your body is looking for. Stem cells are also incredibly anti-inflammatory. So anybody who lives in a chronic inflammatory state or has an inflammatory condition, stem cells are one of the best tools to help mitigate inflammation. Allogeneic stem cells, or the birth tissue stem cells, come from typically nowadays umbilical cords. So what happens is a very screened umbilical cord is collected. Both the mother and the baby go through extensive screening processes, both during the pregnancy and then after the pregnancy. And what happens is this umbilical cord gets collected by a tissue bank. A tissue bank is an FDA-registered organization. So again, this is not some back alley, go find me an organ. This is an FDA-regulated process. That tissue bank then takes the umbilical cord, and they isolate a very special section of that umbilical cord called the Wharton's jelly. The Wharton's jelly section of the umbilical cord has the highest concentration of stem cells. So the tissue bank finds that Wharton's jelly, they isolate the stem cells from it, and then what that tissue bank does is they strip the section of that cell that contains the DNA out. So that donor tissue now is no longer a real donor, if you will, because all the genetic material has been removed. So there's no chance of rejection or cross-reactivity or what we call host-graft reaction because all that genetic material is gone. And so what we're able to do is administer that stem cell, that kind of no genetic stem cell, back into your body, and that same regenerative, anti-inflammatory tissue repair process starts to then take place. And so to your question is we can apply these stem cells for a broad plethora of applications. Most commonly, people think about orthopedic problems, which is probably still the majority of what we use them for. But we also like to use them for chronic systemic diseases. Like I said, anything that's chronic or inflammatory can be applicable here. So, any type of GI issue, any type of autoimmune issue, lengthening our telomeres. There's nothing that lengthens telomeres better than stem cells and exosomes. So that's kind of really what we use them for. Now, quickly, an exosome is something that a stem cell secretes or releases. So think of an exosome as kind of like a signaling molecule. It's basically like a GPS system for your stem cells. So when we administer exosomes throughout the body, it helps your stem cells better attract to the areas of inflammation. Because that's how stem cells and exosomes work. They're programmed to look and attract to inflammation. So if we give you exosomes via an IV, and those exosomes are now circulating through your entire body, they then diffuse and attract to the inflammation, which is then what signals the stem cells to go to that area and start that reparative process.
Are you just hooked up to stem cells all day long? Just mainlining it? I imagine you could overdo it, right? It's like, just have too many, like it's or it doesn't do anything. It's
correct.
Point,
there's
right?
there's a point of no, return, right?
Yeah.
So it's not going to necessarily harm you. The only circumstance it can actually harm you is in people who truly have like autoimmune disease where their immune systems are hypersensitive. And if we blast you with stem cells or exosomes, it can create a, hyperstimulatory response. But the average person, there's never any wrong that can come from it, but there definitely is a point where it's not cumulatively beneficial to do it so often.
Yeah, that makes a lot of sense. I'm curious, how did you get connected with Kuya? Tell me a little bit about how you're setting things up there, how you're, training. I think you're kind of taking your model as well as working in combination with them, almost like a satellite, right?
Yep.
And you're also telling me you have your own compounding pharmacy, which I want to go into why that's important. But yeah, tell me a little bit about the Kuya connection.
Yeah, so I know Kuya is an amazing facility. I thought that, our clinic was the only one kind of building this whole health longevity ecosystem. And then I really got introduced to Kuya. I know the Kuya ownership team really well. Actually, going back to our stem cell days and orthopedic days,
Wow, cool.
Yeah, so the current kind of ownership management team at Kuya is someone that I know in the stem cell world for many years. And, to get connected to a great facility who's doing health and wellness really well, I'm really excited about. I'm really excited to bring functional medicine to Kuya because I think it's the one thing that's going to continue to differentiate Kuya as one of the kind of, global leaders in how wellness gets delivered. So I know the ownership team. That's how I got connected to Kuya. And they've been looking to bring on functional medicine into the space here in Austin, and into the Austin scene for a long time. And, we've built a really successful thing in Florida and New York. And it was just kind of like a natural symbiotic thing. And we're really happy to be a part of Kuya's growth and opportunity to help the Austin community, continue to be really healthy.
Which I'm very excited about. I mean, you can go in there and get your blood work. You don't have to go to a crazy lab, and just impressed with how you guys run things and your philosophy and all that. And also, you're using your own compounding pharmacy. I want to touch a little bit about like what is a compounding pharmacy and, how they can be different, right?
Huge. And this is a huge differentiator for functional medicine clinics. So, in the functional medicine space, we do everything very individualized, right? Which means that the goods that I might prescribe for you need to be made to our specific guidelines and dosage recommendations. And so this is not something that you can just go get at CVS or Walgreens, right? Because they don't do individualized prescriptions. It's, mass production. So we use compounding pharmacies for a lot of our goods. And so a compounding pharmacy is a pharmacy that has the capability to do individualized dosing of a medication. And they can actually do this with anything. So if you're on, say you have type 2 diabetes and you're on metformin, they can do an individualized dose of a metformin capsule for you. A lot of people don't know anything about compounding pharmacies, but it applies to traditional medicine too. But why we use compounding pharmacies is the flexibility and the individuality it allows us to prescribe for patient-specific needs. Now, the problem or the difficult part with compounding pharmacies is that there are different levels of credentialing and certification and goods and manufacturing standardizations. And so not all compounding pharmacies are created equal.
Just like there's some dirty grocery stores and there's some really clean, nice, high-end grocery stores. They're all in business because they pass the code, but there's levels to it, I imagine.
Exactly right. And it's kind of like supplements, right? You could go into GNC and there's literally thousands of different brands all selling vitamin C. It doesn't mean they're the same. It doesn't mean they're equal. And so the compounding world is the same exact thing. And so when we invest in helping someone be their best, we want to ensure that what they are putting in their bodies is the absolute best. And not to speak poorly about the pharmacy world, but there are plenty of compounding pharmacies that probably cut some corners to make their margins better. And unfortunately, it yields into how you do and your success as the patient. And so I swore when I started our practice to never, ever compromise the quality. And so we might not be the cheapest, but you're going to get the very best of the very best.
And that's super important because you say you go to a functional medicine and they recommend these things and I take this 3-4 supplements and this, and they send you to, maybe it's a quality place online, but there's a million different brands, right? And, you don't know the quality of that brand that one time they produced it, or like you don't know, right? And if that's off, technically you're doing the right thing, but then what's in it isn't in it, or it's contaminated or something. And then now you're looking down other paths to try to fix yourself when the supplement just wasn't working.
Right.
And so now it's like you need that assurance that you're getting good quality, especially if you're doing hormones and thyroid and peptides and all those things.
Correct.
Super important, especially if you're going to be putting that in your body.
Super important. Like you said, these are powerful, influential substances. And, if you compromise the integrity of that compound to save yourself $10, you may not end up with a great outcome. And, unfortunately, the compounding pharmacies, they're not all created equal. So we only do business with compounding pharmacies that we know, we trust, we can speak to their manufacturing goods. And, I don't have accessibility to everything. So there are things that we have to outsource, but I vet them and we make sure that they're trusted and they're third-party independent tested. And through my years of practical experience and anecdotal feedback, we know good vendors and non-good vendors. And it makes all the difference in the world.
And I think what I really like too is you have a couple different blends that, like, I'm taking like a sleep blend and I think maybe there's 4 or 5 different ingredients in it. And you were telling me the other day, you can tweak the amount of each individual ingredient. And that's amazing because you can't do that if you buy a supplement. It's a proprietary blend. Maybe it's a sleep formula and there's only this much melatonin, it's got GABA, but then it's got this other random thing that maybe you don't want in it. And then this, or it's a low amount of L-theanine. And you're like, well, I want more L-theanine. So do I have to buy extra L-theanine, buy more of this, but then I don't want that thing. It's like, no, we can just tweak it. To me, I love that a lot.
And that's the beautiful thing about, again, working with compounding pharmacies that you have long relationships with, is they have the capacity to do very specific individualized dosing with things. And that's what you need. Because again, like we said, you're different than me. I'm different than you. So what works for you doesn't necessarily work for me. And we have to have that flexibility to make sure that we're supporting your body the way that your body needs the support.
It will cost a little bit more, but like you said, here's a recommendation of basic, medium, and throw the kitchen sink at it. And coming from someone who's been a trainer a long time and didn't have money for a long time, I've always paid out of pocket. So I always think it's funny when I have certain clients like, oh, that might be a little expensive. You're like, there's a couple things in my life that I'm willing to just throw whatever at money-wise. And health is for sure the number one bucket. So I don't even think twice. But I can get it for people, but I've never thought that way. And I think that's like the best thing you can spend your money on, or else down the road, you're going to be spending it on all these exams and could be chemotherapy. Like, invest in it now, right?
Agreed. And that's kind of the argument. It's like, invest in me now or invest in me more later, right? So that little investment now, again, puts you on the right trajectory. That right trajectory over the course of 50 years actually ends up saving you crazy money down the road. It's the same thing, unfortunately, with the insurances. Wouldn't the insurance world invest in preventative health so that they're not having to pay these $100,000 hospital bills down the road? It makes no sense. But that's how that's how we always approach it with people, is understanding that, yes, if you can, if you're in a place to invest a little bit now, it will pay you dividends in the long run. And, although, like I said, we're not the cheapest option, we still always have a plan and a program for every single budget, every single lifestyle. I always swore when I started our practice that we would never, ever let money be the reason we don't help somebody. And we still live by that to this day. We can't sacrifice a financial gain to help someone be better. So we genuinely have a program that fits everyone's budget, everyone's lifestyle. Like you said, we don't push things on people. We give you options. We say, hey, you can be conservative with this. You can be moderate with this. You could be more aggressive with this. What do you think feels right to you right now? And that's really, I think, how medicine needs to be delivered.
I 100% agree. So what are you most excited for, like, coming down the pipeline? Because I feel like, I think I said this to you before, because when you're in a space and a craft of something you're passionate about and done a long time and you've seen a lot of people, I feel like those individuals have the ability to see a little bit into the future with your specific area. Maybe what are you excited about, or what do you see as a potential like future in the next 10 years with all of this stuff? Or maybe even just your own dream of what you want it to become.
We really hope that the awareness and the attention continues to help our industry grow, right? Because people always talk about, well, this is the healthcare of the future. It's the healthcare of now, but we still need more awareness and more education out there to help define it, right? You could go on Instagram and everybody's talking about something,
Yeah.
right? And so I think there's this kind of very rough definition of what functional medicine truly is. And it's really why we kind of educate people to the best of our ability. So I think that functional medicine will continue to evolve, and we're really excited about that. We really hope that it continues to be more mainstream and people get out of the traditional medical mindset and they really kind of transition into more of this health optimization mindset. So that's kind of my hope for what we do.
I think it's happening.
I do too.
I think it's definitely happening. I think people I feel like I'm seeing the shift where I don't sound crazy when I recommend it to somebody. People are super open to it and they're ready for it.
Agreed.
And I think honestly, the podcast community is a big component of that. People having their own experiences and sharing more of their stories empowers other individuals to feel open to trying something different.
I agree. The power is in the masses, which is why if we can just continue to raise awareness, educate, I think it will shift, definitely. So that I'm really hopeful for. I think some of the other things that I'm really excited about, so I do a lot of work in stem cell and exosome. I'm really excited about the continued development there. We're starting to get into what we call induced pluripotent stem cells, which basically means that we can take a blank canvas stem cell and we can actually start to force that stem cell to turn into a certain germ layer, right? So for example, I can take a stem cell and kind of help it nurture it so it can turn into cartilage or turn into tendon or ligament. Or I can take a stem cell and turn it into a neurologic tissue like myelin or a Schwann cell or a dopamine secreting cell. So that induced pluripotent, meaning it's able to be differentiated, is something that really excites me.
So it's not only getting rid of inflammation or healing, it's literally regenerating it.
A specific tissue type.
That's amazing.
Yeah. that is going to happen sooner than you think.
I think so. I think we're in this interesting time with AI and everything. It's almost like a renaissance, but of a different kind. A renaissance of technology.
Mm-hmm.
And I think health and fitness is going to accelerate a lot. And that's really exciting.
Yeah.
That's why we should all be doing this now. So we're already kind of tapped in and doing these things. You don't want all that stuff to show up later and, your health shit. And you're like, well, it's not much I can do now.
Agreed.
That's why I'm like, I got to stay as fit and healthy and slow the aging process because it's just going to get better.
It's so true.
Yeah.
If you can get through the next however many years, like the technology that will advance in that same next however many years might expand your health span exponentially.
I mean, you already see, I always say this to clients, like you see female celebrities, 50, 60, 70 years old that look like they're in their 30s, right? And I imagine they're doing facelift, this, blah, blah, blah. But like you can't mask what comes through a person when they're moving and talking. Like you can't facelift your brain health.
Right.
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 And so clearly they are doing these things like sauna and more exercise and like taking all of these things in addition to polishing with a facelift to stay youthful longer. And you're seeing that at maybe the higher level because maybe they have more money, but you do have access to start doing these things now.
Correct. And again, these are not therapies that are just for the rich and famous. This is all stuff the average American can afford to do. They just, again, have to be guided as to how they can do it. And that's the key. This used to be a field of medicine where it was for the 1% of the 1%ers. Not anymore. It's really not. And so, we continue to evolve it in a manner that it is applicable to the masses. And that's what excites me. And you brought up another good point, AI. I mean, we get excited about that as well. Some people get nervous with, again, data overload, technologies are going to take over the world. Again, I think that there's always going to be a human element to medicine and healthcare. It will never be able to be completely automated, in my opinion.
I don't think so.
I don't think so, because there is that human element, and there is something to be said about me looking at you, feeling your energy, watching your body language, and that's not something you can train a computer to do.
I've been telling people this too. It's like you can't take out that interesting like that thing that human beings have that is that intuitive like guidance that only humans can have.
Mhm.
And I think because of AI, we will have more opportunities to explore those parts of being human and stop doing so much of that analytical piece and advance our health, which in turn advances our ability to kind of develop as beings or souls and to hone in. Like, you ever listen to telepathy tapes?
A little bit.
So the theory is like that's always been there,
Mm-hmm.
but we're in such a stimulated input world, it's gone away.
Mm-hmm.
So I think things like that as human beings that we had connectivity to will have the opportunity to come out more.
Yeah.
Because the first step, even in any spiritual practice, whatever it is, it's like your health is your body and your health is the temple. And so you can't really develop your individual self, spirit, whatever you want to call it, if that isn't there. And if that is taken care of, the ability to expand that becomes so much greater.
Couldn't agree more.
And so it's like we're kind of dialing that in.
Could not agree more. Absolutely. And to your point, where we start leveraging AI to our benefit is, we like you said, we use it to help streamline efficiency and allow us and our patients the ability to be more present and grounded and to be self-aware. Instead of worrying about all of the if, ands, and whats, you can focus on just you and your energy and your mentality. And that's where AI is useful. We have a platform that we use that basically can look at, I see your Aura Ring.
Oh yeah, I love Aura Ring.
So we have a platform that can actually upload your Aura Ring data into a portal that we can then run your blood work through and look for correlations and trends. You can also log your nutrition habits and your caffeine intake, and it can look at your blood work and look for correlations and trends. And that's kind of really where we get excited about the AI growth is, taking a process that might have taken however long, and in a relatively short period of time, we can look and see trends and things that may have been missed from the human eye. And so that's where we get excited about AI. But to your point, I think it will allow people to focus on being people and not so much the noise around it.
What are some of the other things you guys have in your own? So you have your clinic, but then is it med spa or what is it called?
MedHouse.
MedHouse.
Yes.
What have you put in there? Do you have saunas? What do you have in there?
Yeah, so MedHouse is our social wellness club.
Okay.
And so it's this full encompassing longevity ecosystem. So at MedHouse in our facility in Florida, we have hyperbaric oxygen. We have contrast suites. So our contrast suites are cold plunges with either traditional sauna or cold plunges with infrared sauna. We have full body cryo, so not just cold plunge, but full body non-nitrogen based cryo. We have what's called a sensory deprivation flotation tank,
which is one of my personal favorites.
Same, I'm with you there.
It's so hard to get clients to do it or like anybody to do it. They just, it's difficult.
There are some pretty famous people that really are big proponents of it, athletes in particular, but I love the float tank. It's one of my favorites. We have a Himalayan salt cave. Again, a couple different infrared devices. We do a lot of brain and neurologic work as well. So we have some devices called brain taps. We do a lot of PEMF, different devices and technologies for mitochondrial stimulation. We've got a whole bunch of stuff.
That's amazing. I think Kuya is going to get a couple hyperbaric chambers. I want to just like touch on what have you seen benefit wise and like why do you recommend people do contrast therapy as well as the hyperbaric? I kind of want to touch on both. And the problem with social media is it promotes things and then it puts things out there. Like, for example, I've had maybe 6 females say, well, I heard cold plunging's bad for women. I'm like, oh my God. It's like things are nuanced. Also, it's like, just like the doctor thing, you can't just take something and like, it is good, it is bad, right? It is a potential stressor that creates a an effect that can have a lot of positives. And you don't have to be, an ex-Navy SEAL and do 5 minutes and 35 degrees. Like, you can slowly use these things like lifting weights. You can use a 5 before you use the 30, right? Like, you can slowly expose your things and get the benefits from them. But what are the benefits you see with people having contrast therapy?
You stole my thunder. I mean, that was, you want a job? So yeah, I mean, truly the medicinal benefit of contrast is creating that stress environment in a micro stress fashion to elicit what we've been talking about, which is that regenerative cascade. So there's arguably nothing better that stimulates stem cells than micro trauma. So going from those extreme temperature variations, it's enough of a catalyst to ignite that dormant stem cell to get activated and to kick into gear. We like, as much as we talk about fight or flight mode being bad, fight or flight mode is good for a very short interval because it releases a lot of endorphins and neurotransmitters and, again, activates stem cells. So when you do that enough in a cumulative fashion, you continuously have that stem cell activation. You have a lot of that reparative cascade that continues to be active. And so contrast therapy, in my opinion, is one of the easiest things that you can do to really help yourself. And again, you don't need a fancy membership anywhere. You can get out in the sun. You can then run inside and get in a cold shower, right? So it doesn't have to be this like $1 million membership in order to do it. But it's great if you can. But it doesn't have to be that, But that's the beautiful thing about contrast is it's really creating that very short stress response, which is what activates that healing cascade. Hyperbaric, on the other hand, is a great modality because hyperbaric basically helps flood the body of oxygen. And oxygen does a couple different things, but oxygen is one of the most reparative elements in the human body. So it really helps with tissue regeneration. It's actually one of the best ways to stimulate the production of new blood vessels. So we were talking about vasculature earlier. Hyperbaric oxygen basically helps with angiogenesis, which is the creation of new blood vessels. So people who have had circulation issues or strokes or, compromised circulation, hyperbaric is arguably the best thing you could do.
Like me, I was 16, 17. I went to a doctor one time, and a couple of years before, I would go on walks as a kid. And when you're a kid, you get pains, but you can't you have no idea how to describe what you're experiencing. And I remember my legs would ache so bad to the point they would almost like cramp. And I went to a PT and he gave me these heels and he's like, "Oh, it's your Achilles," which is so dumb. My Achilles is tight. So you give me basically a thing to continue to make it shorter by PTs are a whole nother subject I can't even get into. And I go and they finally realize I have, the doctor said to me, basically, quote, "You have the veins of a 75-year-old man in your legs." So the old way, I guess it's different now, but they stripped them.
Yeah.
So like cutting your groin, they put wires down them and they strip them. And I've always especially living in Seattle, had circulatory problems. And so I was told that they kind of grow over time. Like the new pathways develop, but it would have been great to have something like that because it would have probably helped so much. And I still have some that are newly developed. So that's, so important.
So important. And in addition to growing new blood vessels and helping to repair, I mean, oxygen also is very antimicrobial. So nothing can survive in an oxygen-rich environment. Bacteria, viruses, parasites, mold, right? That's why they use ozone to kill stuff on the planes, right? Ozone is concentrated oxygen.
Okay.
So oxygen or hyperbaric oxygen is also very antimicrobial. So it can be really great for, again, people who have had chronic infectious stuff going on. That's why it gets used in wounds, because it helps with angiogenesis and it's antimicrobial. That's why it's so successful for wound healing. So it's really great, but really where I find great benefit with hyperbaric oxygen is with neuroplasticity and neuroregeneration. It's one of the few things that can cause brain tissue and neurologic tissue to regenerate. So at our office in Florida, we treat a lot of, brain issues, whether it's Parkinson's, MS, traumatic brain injury, chronic concussions, post-stroke, early Alzheimer's, whatever it is. But hyperbaric is a phenomenal tool for neuroregeneration.
What would be like the protocol for that? Is it like, say you don't have it, you're just trying to increase your health. Is it like a once every 3 months, or do you need to kind of do it stacked once a week for 6 weeks for the benefit to occur?
Yeah. So something like hyperbaric, you do have to kind of do it more cyclically because it's cumulative. So it's always building upon the work that it's doing. So for a longevity protocol, young, healthy, fit guy, maybe someone like you, they want to just come in and start doing hyperbaric because they know it's important for circulation and brain health and all the things. Yeah, we probably recommend, like a once or a twice a week thing for 6-8 weeks. And you can take a break, then you probably repeat that, and you kind of do that cyclically throughout the year.
Got it. That's awesome.
Yeah.
Well, I appreciate so much for you taking the time. I mean, you're a busy guy.
It's my pleasure to be here. Thanks for having me.
Yeah, just tell everybody listening how they get started if they're interested.
Yeah, I mean, I definitely would challenge anybody who's listening or watching, just don't settle. If you're sick of feeling sick, if your primary care doctor tells you continuously that everything is good, everything is fine, but deep down it's not, it's because it's not. And you need to switch how you're thinking about healthcare and health optimization. So for anyone who's really kind of on the fence, or they just intuitively have not felt like their health is being managed well or really optimized, or they're not feeling being heard. That's the other thing I hear all the time is I just don't feel like I'm being heard. And that's crazy in healthcare to not be heard. So if you're feeling that, reach out to us. Whether you reach out through Kuya, whether you reach out to us at R3 Health, reach out, educate yourself. At the bare minimum, get some testing done. Again, we don't have to do anything. Let's just see where you're at and have a discussion about it. But definitely connect with us. Kuya here in Austin, if you're local here. If you're throughout the globe, reach out to us at R3 Health. We service patients in 40 states and 10 different countries. So a lot of what we do can be done remote, but definitely if you're in the Austin proper, get yourself to Kuya. There's really no place like it around.
One more thing. Any more books coming out?
Oh, man. I really, really do want to write a second book.
Do you have like a brief, like something you could give us, an appetizer of what it might be about?
Yeah, it's really going to definitely be about our philosophy and how we treat people.
Nice.
So it's going to really dive into more about how to truly kind of be optimal and how, our traditional system just doesn't recognize that. So yes, I can't tell you when. Got to find some time to write it.
Yeah, for sure.
But yes, it'll really focus on really how to be the best version of yourself.
I'm excited.
Yeah.
Well, I look forward to having you back, and we'll discuss what's changed in the world of medicine, and maybe update on my health and all that, and it'll be awesome.
Yeah. No, thanks for having me. I appreciate it, and happy to be back anytime.
Thank you.